Hi, my name is Riley. I'm going to be your nurse today. I'm going to be performing a head-to-toe assessment on you. Can you tell me your full name and date of birth?
Simon Glenn Smith, August 7th, 2002.
Can I check your wristband? That's correct. When I enter the room, I'll pull the curtain for privacy and perform hand hygiene. And do you have any allergies?
No.
Do you have any cultural or religious preferences you'd like me to know about?
No.
Okay, and how are you feeling today?
Good.
Are you in any pain?
I'm in a slight little bit of pain on my leg.
Can you tell me how that happened?
I tripped and skinned my leg.
Does anything make it better or worse?
No, I applied some medication to help with the healing.
Does anything make it hurt more?
Not particularly, no.
Alright. Can you tell me the quality of the pain? Is it dull, burning, sharp?
Sharp.
And can you tell me where it is exactly?
On the left side of my lower left calf.
Okay. Does it radiate anywhere?
No.
Alright. And can you rate it on a scale of 1 to 10?
4.
And how long have you had it?
One day.
Would you like any pain medication for that?
No, thanks.
Alright, I'm just going to perform a general survey now. Your skin tone is even and appropriate for ethnicity. You don't appear to be in any distress. Your respiratory effort is unlabored. Your behavior is positive. I don't notice any involuntary movements, and any body movements are smooth. And can you tell me about your mood?
Feeling good?
So your mood's congruent with your affect. Your body structure is healthy and your posture is erect. You appear to have good hygiene, are well groomed, and are dressed appropriate for the season. I don't know any odors. And do you use any mobility aids?
No.
Okay. So now I'm going to test your cranial nerves. So for cranial nerve 1, I'm going to have you close your eyes and plug a nostril and tell me the scent.
Alcohol.
Yep. And can you take a breath in and out of that nostril? Any trouble with that?
No.
All right. Same thing to the other nostril. Can you tell me the scent?
Thieves oil.
And can you take a breath in and out? Any trouble?
No.
All right. Nostrils are patent and cranial nerve 1 is intact. For cranial nerve 2, I'm going to have you read what this says.
Alcohol prep pad.
Any difficulty seeing that?
No.
You have good visual acuity and can read 12-point font, and cranial nerve 2 is intact. For cranial nerves 3, 4, and 6, first I'll have you follow my finger in the 6 cardinal gazes. Okay, no extraocular movements or nystagmus are noted. Now can you follow in? All right, pupils converged. And can you look at my finger and look at the wall behind it? And back at my finger. No, back at the wall. Pupils dilated and look at the wall and constricted when they looked at my finger. And I'm just going to shine a light in. You can stare straight ahead. Your pupils constricted equally bilaterally. The eyes are perla and 3 millimeters in size. Cranial nerves 3, 4, and 6 are intact. For cranial nerve 5, I'll have you close your eyes and tell me if you feel dull or sharp sensation on your face.
Sharp. Dull. 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 Sharp. Dull.
All right, patient can accurately describe sensation in his face. Cranial nerve 5 is intact. For cranial nerve 7, I'll have you make a series of facial movements. Can you puff out your cheeks? I'm going to press. No air comes out. Can you smile? Frown? Can you raise your eyebrows? Any trouble with that?
No.
All right, and facial movements were symmetrical while doing that, so cranial nerve 7 is intact. For cranial nerve 8, I'm going to whisper a 2-syllable word into your ear, and I'll just have you tell me what it is.
Basketball. Football.
Okay, you accurately told me the words, so cranial nerve 8 is intact. For cranial nerve 9 and 10, I would depress your tongue, but I don't have a tongue depressor, so I'll just have you stick it out. And can you say ah? The uvula and soft palate rose midline of phonation. And can you move your tongue back and forth? Any difficulty with that?
No.
All right, cranial nerves 9 and 10 are intact. For cranial nerve 11, I'll have you shrug your shoulders. And now against my resistance. And now turn your head. Other way, against my resistance. Any pain, tenderness, or difficulty with that?
No.
All right, cranial nerve 11 is intact. And for cranial nerve 12, I'll just have you stick out your tongue and I'll inspect it. No atrophy or tremors are noted. And can you swallow? Any difficulty with that?
No.
Alright, cranial nerve 12 is intact. So now I'm going to move on to your neurological assessment. Do you experience any dizziness?
No.
Any numbness or tingling anywhere?
No.
Any memory loss?
No.
And can you wiggle your fingers and toes for me? Alright, can you feel my touch
Yep.
on them?
Yep.
Alright, I'm going to test your patellar reflex. Just relax your legs. Okay, they are both +2. And now I'll have you stand on the couch with one foot back. And I'll just have you tell me if you feel a dull or sharp sensation.
Sharp. Dull. Sharp.
Alright, can you lift your other foot up?
Sharp. Dull. Dull.
Alright, you accurately describe the sensations in your feet. You have good sensory function. And I'll have you walk. I'm going to assess your motor movements. Okay, your gait is smooth. I don't know any unsteadiness or involuntary movements. And now I'm going to test your coordination. Can you do a series of rapid alternating movements? Touch your finger to your thumbs. Good. And can you do your finger to your nose? Alright, you have good coordination. I'm going to test your balance. Can you stand on one foot? Now on your other. Okay, and we're going to do a Romberg test. Can you just stare straight ahead with your feet together and hands at your sides? And you do this for about 30 to 20 seconds. But for this video, we'll keep it short. And you have good balance. So you can sit down. And I'll just have you bend over. And I'm going to inspect your spine and palpate it. There is slight curvature. Is there any pain upon palpation?
No.
Okay. So now I'm going to move on to your integumentary system. Do you have any skin changes that concern you?
No.
Any moles that
No.
concern you? Do you have a history of skin cancer?
No.
Do you burn easily?
No.
Okay, I'm just going to inspect. I don't see any masses, lesions, scars, or tattoos. Upon inspection, hair distribution is even all over the body. And I'm going to palpate. Is there any pain or tenderness with this anywhere?
No.
Okay, I'm going to feel your temperature. It is warm and even bilaterally. There is no presence of exudate. There is no tenderness, no masses or lesions. Hair distribution is even, and skin is warm. I'm going to move on to your musculoskeletal assessment. Do you have a history of falls?
No.
Any muscle pain?
No.
Any joint pain like arthritis?
No.
Do you have any concerns?
No.
Okay. I'll have you stand up. We're going to do some range of motion. Can you move your neck back to the side? Can you bring it to your shoulders? Can you shrug your shoulders? Can you lift your arms? Move in a circle. Can you bend at the waist? Can you go side to side? Can you twist? All right. Can you bring your leg up? Other leg. Can you bend at the knee? Other knee. Can you move your feet in a circle? And your wrists in a circle? Is there any pain or tenderness with that?
No.
All right. So you have full range of motion, and can you also squeeze my hands as hard as you can? Grip strength is a 5 and equal bilaterally. And you have no limitations with your range of motion. So you can sit down. And now I'll move on to your head and neck. I'm just going to inspect. There's no masses or lesions that I see, any scars or tattoos. Your hair distribution is even. I'm going to feel your hair. Is there any tenderness with this?
No.
I don't feel any masses or lesions. The color of the hair is brown. You have a large quantity of hair. It is smooth. And there's no signs of infestation or parasites. And I'm going to palpate your face and your neck. And your trachea appears midline, also feels midline. Was there any pain or tenderness with that?
No.
Okay, and I didn't feel any masses or lesions. And do you have any headaches?
No.
Any history of brain injuries?
No.
Do you have any family history?
No.
Any concerns with your head or neck?
No.
Okay. And was there any pain with the neck range of motion earlier?
No.
Okay. Now I'm gonna feel your cervical lymph nodes, so your preauricular, postauricular, occipital, segmental, semimandibular, jugular digastric, superficial cervical, deep cervical chain, posterior cervical, and can you shrug your shoulders? And then your supraclavicular. Was there any pain with that?
No.
And they were non-palpable. And I'm gonna feel your carotid arteries one at a time. They're +2 and even bilaterally. And I'm gonna listen for bruits with them using the bell of my stethoscope. Okay, there are no bruits present. Now I'm gonna move on to your eyes. Do you wear any eyeglasses or contacts?
No.
Do you have any blurred or double vision?
No.
Do you see any floaters or blind spots?
No.
Alright. I'm just going to inspect your eyes. The hair of your eyelashes and eyebrows are distributed evenly. I don't see any masses or lesions. Your cornea appears clear. Your sclera is also clear and white. There's no jaundice or erythema. I'm going to pull down on your conjunctiva. It is also clear, no jaundice, erythema, drainage or swelling, and the eyes are not protruding. Now I'm going to move on to your ears. Do you wear any hearing aids?
No.
Do you have any trouble hearing?
No.
Any ringing in your ears?
No.
Alright. I'm just going to inspect. They are symmetrical. They are in line with the corner of your eyes. The shape is normal, and they are at an average spot on the head. I don't see any drainage, masses, or lesions. I'm also going to inspect. There is no drainage in either ears, and there is a normal presence of cerumen. And now I'm going to palpate. I'm going to pull on your pinna, push your tragus, push your mastoid. Any pain with that?
No.
Alright. I'm going to go into your nose. Do you have any trouble smelling?
No.
Do seasonal allergies affect your smelling?
No.
Any pain anywhere?
No.
Do you get nosebleeds?
No.
Okay. I'm going to inspect. There's no masses or lesions. It is midline on the face. And can you look up? The septum is midline and not deviated. Cilia are present, and the mucous membranes are pink and moist, and the turbinates are symmetrical and not hypertrophied. Now I'm going to move on to your mouth and throat. Do you have any trouble tasting or swallowing?
No.
Any recent changes with it?
No.
Do you have any bleeding or sore gums?
No.
And how often do you see your dentist?
1 to every 4 months.
Okay. I'm going to inspect. Your lips are appropriate color. They are not dry or cracked. I don't see any masses, lesions, or sores or ulcers around the mouth. And now can you open up? I'm going to inspect. The teeth are intact. The mucous membranes are pink and moist. The gingiva is pink and not swollen. And the uvula is midline. And I don't see any masses or ulcers or lesions inside the mouth either. And now I'm going to move on to your respiratory assessment. Are you comfortable taking your shirt off?
Yeah.
Okay, can you do that? Okay, I'm going to inspect. I don't see any masses, lesions, scars, or tattoos on the anterior chest or on the posterior chest. The hair distribution is even. The chest expansion is symmetrical. And I'm going to observe your respiratory rate. Normally you do this for a minute, but for the sake of the video, I will go shorter. Okay, I went for 30 seconds, so I multiplied by 2, and I got 20. And your chest expansion is symmetrical. I'm gonna compare from the side to the anterior, and there's no presence of barrel chest. And can you stand up for me? I'm gonna have you take a breath in and out. Okay, chest expansion is symmetrical, and again on the back. Chest expansion symmetrical. And I'm gonna test for tactile fremitus. So every time you feel my hand, can you say 99?
99, 99, 99, 99.
All right, vibrations are present, and my hands are at T9 and T10. And now you can sit back down. I'm just gonna auscultate your lungs using the diaphragm of my stethoscope. Can you just take a deep breath in and out for me every time? Okay, there's no adventitious sounds anteriorly. And now I'll listen posteriorly. Can you lean forward for me? Just take a deep breath in and out again. No adventitious sounds on the posterior chest as well. And again, your breathing is unlabored and your chest expansion is symmetrical. And now I'll move on to your cardiac assessment. Do you have any heart palpitations?
No.
Any chest pain?
No.
Do you have any history of heart disease?
No.
Any concerns about your heart?
No.
Alright, so I'm just going to inspect your precordium. I don't see any pulsations. And I'm going to palpate, and you do this for 30 seconds. And if you feel pulsations, this is normal if you're under 30. And I do feel pulsations. And now I'm going to compare your pulses. So I'll start with your brachial. You're +2 and even bilaterally. I'll see your radial. +2 and even bilaterally. Can you stick out your legs? Your popliteal. +1 and even bilaterally. Your posterior tibial. +2 and even bilaterally, and then your dorsalis pedis. +2 and even bilaterally. And I'm just gonna feel your upper and lower extremities for edema. Is there any pain when I palpate?
No.
Okay. And there is no presence of edema. And I'm gonna listen to your heart. First, I'll start with the diaphragm of my stethoscope and your aortic, pulmonic, first point, tricuspid, and mitral. And here I'm going to listen for a full minute to get your apical pulse. Okay, and the apical pulse is 68. And S1 and S2 are present. And I'm gonna go over again with the bell of my stethoscope. And the aortic, pulmonic, Erb's point, tricuspid, and mitral. And there's no presence of S3, S4, or any murmurs. And now I'll move on to your GI assessment. Can you tell me when your last bowel movement was?
A few hours ago.
Okay. Do you have any trouble urinating?
No.
Any pain, burning, or hesitancy with urinating?
No.
Do you have any problems with indigestion like constipation or reflux?
No.
Alright. And are your bowel movements and urination frequent?
Yeah.
Okay. So can you just lay down on the couch for me?
Should I lay the other way?
Yeah, can you lay the other way, please? I'm going to inspect the abdomen. The contour is flat and smooth. The hair distribution is even. The umbilicus is midline. And I don't see any pulsations like peristalsis or heart sounds. And first I'm going to listen in all four quadrants for bowel sounds with the diaphragm. I'll start in the right lower quadrant and move on when I hear a bowel sound. Okay, bowel sounds are active in all four quadrants. Now I'm going to listen for bruits with the bell. I'll listen to the aortic spot, which has 1. The iliac, which has 2 spots. Renal, which also has 2. And the femoral, which also has 2. There are no presence of bruits. And now I'm going to palpate your abdomen. First I'll go lightly. Is there any pain or tenderness with this? No. Alright, I'm going to go a little deeper. Any pain or tenderness? No. And the abdomen is not rigid. I don't feel any masses or lesions. And it is not distended, and there's no tenderness. And again, no exudate anywhere. The temperature is warm and even bilaterally. There are no masses or lesions, and the hair distribution is even. And you can sit back down. I just have a few things to go over before we end. I'm just going to feel all your extremities. There's no atrophy of the muscles noted. There's good muscle mass. And is there any tenderness with that?
No.
Alright. And did you have any shortness of breath that you experienced?
No.
Any problems breathing?
No.
Do you have a cough?
No.
Alright. And overall, your skin is even and appropriate for ethnicity. There are no masses or lesions or scars anywhere. You do have an area of redness on your leg, but other than that, your hair distribution is even, no presence of exudate, and the temperature is warm and even bilaterally, and there's no pain or tenderness anywhere. And do you have any questions before we end?
I don't.
Alright, that concludes my assessment.